Go.
Sickle cell anemia is an inherited blood disorder that is passed through families. Sickle cell disease is a serious disorder in which the cells form an abnormal crescent shape. Normally, red blood cells form disc-shaped cells that move easily through your blood vessels. Red blood cells contain an iron-rich protein called hemoglobin. People with sickle cell anemia contain abnormal hemoglobin called sickle hemoglobin S or hemoglobin SS. These cells tend to block the blood flow in the vessels of your limbs and organs. When the blood flow is blocked, it can cause pain, serious infection, and or organ damage. Normal blood cells can live about 120 days in the bloodstream, but sickle cells die about 10 to 20 days. Sickle cell disease is mostly common in the African American community, but it has been seen in people who are Mediterranean descent, people from South and Central America, the Caribbean, and the Middle East. Excuse me. Sickle cell anemia is an autoimmune recessive gene disorder caused by the defect in the HBB gene, which codes for hemoglobin. The presence of two defective genes is needed for sickle cell anemia. If each parent carries one abnormal gene and one normal gene, each child has a 25% chance of inheriting two defective genes and having sickle cell anemia. A 25% chance of inheriting two normal genes and not having the disease, and a 50% chance of being an unaffected carrier like the parents. Signs from sickle cell anemia usually show up in infants when they reach 4 months old. Some common signs may include hand-foot syndrome with swollen hands and feet, may be the first sign of disease in babies. The swelling is caused by blockage of blood flow to their hands and feet. Episodes of pain. These periodic episodes of pain are called crises, and they are the main symptom of the disease. The pain develops when the sickle-shaped red blood cells block the blood flow to vessels to parts of your body. These painful episodes can last from a few hours to as long to all day. Although some patients with sickle cell have seen these episodes every few years, others can have many episodes that require them to be hospitalized. Delayed growth. Many infants and children born with sickle cell have slow growth. As they hit puberty, it can also be delayed. Vision problems. The blood vessels that support your eyes can become plugged with sickle cells. This can cause people with sickle cell anemia to experience vision problems. It can also damage the retina, the portion of your eye that processes visual images. Frequent infections. Crescent-shaped blood cells can clog the spleen and prevent it from doing its job, helping the body kill germs. Doctors commonly give infants and children antibiotics to avoid life-threatening infections. Other problems associated with sickle cell anemia include chest pain, trouble breathing, stroke, gallstones, blood in your urine, pneumonia, painful erections, and anemia. Sickle cell disease can be controlled. Currently, there is no widely available cure at this time. However, researchers are working hard to find one. Bone marrow transplants offer the only potential cure. Finding a donor is difficult, and the procedure has serious risks, including death. However, there has been some success in the United States and Europe. Medications may include pain relievers, antibiotics, along with drugs to prevent dehydration. Some people with sickle cell disease may also take vitamin supplements, antibiotics. Children begin taking antibiotic penicillin when they reach about 2 months old and will continue until they're 5 years old. Sometimes they will have to continue beyond this age. Taking these antibiotics help prevent infections such as pneumonia, which can be life-threatening in infants and children. They can also be of value in adults who have with this disease fight certain infections. Pain relievers. Over-the-counter pain relievers and the application of heat to the affected area may help to relieve the pain through the crisis. However, your doctor may opt to prescribe something stronger. Over the years, doctors have learned a great deal about sickle cell. They know the causes, how it affects the body, and most importantly, how to treat many of its complications. Sickle cells vary. Sickle cell varies from patient to patient. Many people with the disease have lifelong chronic pain or fatigue. However, with proper care and treatment, many people who have the disease can have an improved quality of life and reasonable health. Today, due to the improved treatments and cure, people who have sickle cell anemia are living well into their 40s and 50s or even longer.